Welcome to the Say Hello to Your Therapist podcast. I'm Dr. Bethany Valenti. Join me as we say hello to Dr. Carly Deremo, a psychologist who, while trained as a generalist, specializes in sex therapy and couples therapy. She is also a friend and close colleague who attended the same graduate program that I did. Today we chat about all that. What does it look like to work with a couples therapist? What is sex therapy and couples work? What does it mean to have a feminist therapist? As you will likely be able to tell, I was also hoping to ask more about sex therapy in general, but that was a big topic and we decided to save it for another time. Carly joined me on the tail end of her maternity leave while her baby napped with grandma. We managed to cover a lot in the time that we had, so I'm grateful to Carly, her mom, and her little one for giving us this great conversation. I hope you enjoy. Don't forget to check out the show notes for where to find out more about Carly and the things we talked about. Hello, welcome, Carly.
Hi.
I'm so happy to have you here. If anyone picks up on any bias, you're not wrong. Carly is just one of my favorite people. So we're just going to jump in. Carly, can you tell us a little bit about what made you want to become a therapist? Actually, don't even though we went to the same program. So
Actually, I do think it started out as a super cheesy, idealistic thing of I want to help people.
Yeah.
But I did always think that was going to be a medical doctor. So I did start out in college as pre-med. And it turns out I'm really bad at chemistry. Can't pass. So that's not where my intelligence lies. So met with an advisor and she was like, what did you kind of envision with pre-med? I was like, I love the idea of just meeting with patients and helping them. And I love people. And she and I just kind of chatted a little and she was like, yeah, you've got good social skills if you thought of, because with me, any conversation can turn into hours long. And
I can confirm.
Yes.
Just great social skills. We're both very chatty, very extroverted.
Yeah. So she recommended psychology. I took an intro course and just loved it immediately. I thought it was so fascinating. I was excited to go to classes again.
Yeah.
Homework didn't feel like the worst thing ever. I truly just find people fascinating. The farther I went along, the more I learned about different disorders. And then into grad school, when I got working with clients, I was like, oh my gosh, yes, this is totally where I want to be. I do want to help people. That's still the same.
That hasn't changed.
Yes, I think the more I've practiced, I realize that's a lot easier said than done because some things that the people need to help them are things outside of our control. And so it's more about weathering the storm than making the storm go away. But yeah, I still love people for the most part and enjoy spending time with them. And ultimately, the more I've done this work, I truly feel like it is one of the highest honors for people to let us into their lives. So that is very fueling, even when the work is challenging.
I totally echo that. It's challenging work that we do, but it's also such an honor and a privilege to be able to do it. I love it so much. Fun fact about Carly is that we're both trained as generalists in our program, which means we work with all sorts of things, not any major niches. Our specialties and our niches have we have some overlap, and then we have some, Carly's specialties are totally outside of my wheelhouse. And so I am super excited to talk about both couples and sex therapy because those are some of your main areas of work, right?
Yes. And I would say vice versa because I tend to shy away from grief work. I don't think it's where I shine. And I know that's where you absolutely have specialty and expertise. So we're good complements to each other.
Yeah, that's why we don't all need to be great at everything.
Yeah.
We just need to know who to talk to and who to refer to and all that good stuff. So how did you end up being drawn? Because it started out as I want to help people. How did we draw the next steps to couples and sex therapy? Because when you and I knew of each other, I think when you first entered the program, but we didn't really start spending a lot of time together until your internship year. But you knew, I remember at your internship interview that you were interested in sex therapy at that time.
Yeah. My interest first really started, it was in my master's program, but I ran a group therapy for sexual assault survivors. And I was drawn to that group mainly because that group had a lot of fun. And I know that doesn't sound like a very fun group, and it certainly had very serious content, but the use of humor and fun and bonding in that group process really like drew me to that population.
Yeah.
So really like my interest started primarily with sexual assault survivors, female sexual assault survivors. And when I was trying to decide what to do for a dissertation, I just saw a gap in the literature around how to get those folks back into better sex after having really bad sex. With combat veterans who have trauma, we have so many therapies out there to get them reintegrated back into combat and their lives and all these things. And like for sexual assault survivors to get back to good, healthy, pleasurable sex was like I kind of had to dig to find stuff out there for that, which I'm like, wait, that's a part of our lives just like anything else. So that's really where it kind of started. And so then doing more research for my dissertation got me more and more excited about sex therapy and sex interventions for folks. So it started first with individuals. Then, of course, with doing sex therapy, there's a lot of interventions geared towards couples. And so one of my practicum sites was at a private practice, and that's where I started getting some exposure to working with couples. And it's a lot more energy working with couples in a room than just an individual.
More than one person in there.
Yes, but I like that energy, and I got to play with a different style of therapy with couples. So I feel like with couples, I have a much more active role, and with individuals, if people need that individually, I can do that too. But I find that that's probably a slightly more passive role. So I also kind of liked that, I don't know, every day wasn't feeling the same. I got to play with different styles and interventions, and I like the energy. I am an extrovert, so the more people there are, the more I fuel. So that's kind of how then it transitioned into loving couples work, and then sex therapy you can do with individuals and with couples that I can share more about it if folks want to know about.
Yeah, absolutely. So my thinking was let's chat about kind of your couples work and then chat about what sex therapy looks like with couples work and then sex therapy with your individuals. Like a natural. So there are a couple different approaches to couples work. It's are you like a Gottman trained person or are you like an
I'm not
eclectic-y?
formally Gottman trained. So I do know Gottman techniques just through like, my own study and all of that, but I have not done like the formal Gottman training.
Yeah.
So I would say my general approach to individuals and couples is the same as far as like theoretically, I'm a feminist therapist. So that is always going to be like my home base theory, which I kind of say that's like the accent with which I speak. So just like I have a Cincinnati accent, I also have a feminist accent. So any intervention I pull from other theories is going to have a feminist theoretical accent to it. So with that is like egalitarianism, making sure there's equal footing in the room, in the relationship. I try to have a very power down approach. I'll power up if I have to kind of gain control of the room. And that happens probably a little more with couples.
Yeah. A little more redirection sometimes.
Yeah. And like power dynamics are a lot more intense, I think, when couples are arguing versus when it's me and a client individually. So that's always going to be like my general framework. But with couples, it's a lot of coaching and a lot with like communication. Most people are needing to improve their communication, most couples when they're coming, but also most couples are just not very good at emotional understanding and validation. So we get into these power struggles of who's right and wrong versus I want to understand you better without anybody having to admit right or wrong. So it's a lot of like emotion focused work, definitely still a lot of feminist type stuff as far as like having equal footing, having equal say, defining even what equity in the relationship looks like. That's different for everybody.
Yeah.
And then, some of that active coaching with skills, learning how to have conflict and talk to each other.
Right. Goes hand in hand with the empowerment element of feminist work, right?
Yes.
And who don't know about feminist therapy, it really has a lot to do with Carly and I are both super into feminist work. So it's like less about what the stereotype feminist term is and more about like the school of thought of like every individual brings like their identities with them and there's power dynamics in any relationship and we as like the experts want to try and minimize that and create as much of an equal footing as possible while also not like telling them per se what exactly to do. Like you can make recommendations or whatever. It's very like empowering in terms of like like allowing the client to steer the way.
Yeah, I think too the piece of feminist theory of like consciousness raising is a huge part of work I do with individuals and couples. So like raising our awareness and our consciousness around what we're doing, why we're doing
Yeah.
it, which
Yeah.
systems have kind of maybe even pigeonholed us into doing things a certain way. And then
Yeah.
examining, is that working for me or not? And if it's not,
Literally. Yep.
let's like broaden the choices there. So
Yeah.
like a lot about like choice, a lot
Mhm.
about consciousness raising awareness, raising
Mhm.
awareness as to what's happening, why is it happening, is this working for me, what other options do I have? And like that, I think kind of part of feminist theory, but also just maybe in general my approach to, well, this is probably more about like cultural competence and all that, but even just like there is so much that goes into couples work about like increasing our humility as well and being able to be
Mhm.
humble and admit when we have messed up or have
Oh,
hurt
yeah.
somebody, and to be able to apologize without it being a dig to the ego. Like
Mhm.
something most of us can agree on is apologizing sucks. I hate apologizing. I hate when I have to apologize to my husband.
Ah,
And it's like, even though as I'm a couples therapist, I know that doesn't mean you're a bad person.
yeah. Yeah.
Good people apologize if we want to use
Yeah.
that binary, but it's like, it just feels so vulnerable to have to admit when
Mhm.
you've done wrong and hurt
Mhm.
somebody, and then to not feel like absolute garbage afterwards. It's like
Yeah.
that's what happens when you're close with people is you hurt them sometimes.
Yeah.
Well, that's another huge piece of couples therapy that I'm trying to infuse is like, hey, we're gonna mess up, we're gonna hurt each other.
Yeah. Yeah.
Let's just try to figure out how to apologize and try
Mhm.
and minimize it in the future and
Mhm.
like improve our ability to be humble and admit when we've messed up.
Yeah,
You can
like
hear
that's
a
such a
lot.
powerful yes, that's such a powerful thing to be able to say
Mhm.
is we're not striving for perfection.
Yeah.
We're trying to strive for some progress and improvement. And that is often even just being able to admit or acknowledge where we messed up, or at least
Mhm.
acknowledge when our actions affected somebody else.
And that actually is another way, like back to the feminist piece, how I try and manage power in the room. Cause like
Mhm.
as you know, the doctor in the room, we
Team.
might hold more power then, but a lot of feminist therapists will use self-disclosure to try and power
Mhm.
down. And like,
Mhm.
so I will give the example of like me and my husband, and I will
Same.
say to my clients, like, I fucking hate when I have to apologize. That totally
Mhm.
sucks. And I'll say, like, oh yeah, I completely did this the other day and it bulldozed my husband. That wasn't cool. Or he did this and it was hard
Mhm.
for him to admit that he invalidated me. And
Mhm.
most of my clients know
Especially
that my
yes,
husband
I
is
was
a
about to say
therapist
you should
too.
probably share that
Yeah.
to it
So
too.
it's like, okay, if you've got two therapists who are
Yeah.
married to each other and we're allowed to mess it up and we do mess
Mhm.
it up, certainly
Mhm.
you can too. So that's another way of like, I'm not modeling perfection because it
Nope.
doesn't exist. I'll
Yeah.
use self disclosure to also just build comfort in the room and help it feel
Normalize.
as
Mhm.
friendly as possible. And like,
Mhm.
hey, I'll give examples of my husband messing up and of me messing up because I don't
Mhm.
want, if I'm working with a heterosexual couple, I don't want them to assume that I'm always going to side with the female partner. Or
Yeah.
so I also try to give examples of me being in the wrong and my husband being in the wrong to kind
Mhm.
of try and manage the power as best I can and just
Yeah.
like be authentic because like that's typically how
Yes.
people talk to each other.
Yes,
Yeah.
that's what we want.
Yeah.
Honesty, yeah. And so if someone comes to you for couples, what does it usually look like? If I were to be working with a client dealing with some stuff with their partner and looking at couples therapy, I would be like, I know a really good one. I'd love to send you to her, but here's what you could expect from that. What could I tell them?
So, I mean, an intake looks pretty similar with couples as it does individuals. So, the first session, I try to just tell folks, hey, it's a lot of info gathering. We're not going to be doing a bunch of super intense, deep stuff. You're not going to
Mhm.
be, you don't have homework or anything right off the bat.
Mhm.
I'm just going to have you come in. I'm going to be getting individual histories from both people so I can understand individually what has brought you here, for better, for worse. I'm going to ask what you're doing really well as a couple because we usually forget to ask about what people are doing well. I'm
Mhm.
going to ask what are we struggling with and what's the history or the timeline of that struggle. So it's usually like, oh, we did really well. And then our communication just really fell apart when we had kids or when I went back to work or, you know, after my mom got sick or so
Mhm.
getting that timeline of, okay, when were things really good, when they go off the rails, just to kind of get the historical piece there. So, first session is truly just a lot of info gathering and just trying to get a general sense of their style, how they're arguing, disagreeing, agreeing, and just trying to get a general sense of style when I first meet them. I offer to couples, we can do intake a couple ways. I tell every couple we can do it all three of us together the whole time. If it is helpful at all, we can break it up a little bit where I meet with one partner for maybe 20 minutes, the other
Mm.
partner for maybe 20 minutes, and then the last 20 minutes we all come together. Sometimes that can be helpful for folks to just speak freely without having to
Edit.
edit,
Yeah.
and I can just get a slightly more forthright
I think that's, yeah.
a forthright version of things. But what I always tell folks, I tell this with all couples, whether they decide to do intake that way or not, is that I am not a secret keeper though. So if we are doing this, it's because we are choosing to bring all things into the openness here. So, yes, it's not like I'm taking a recording device and putting it back to the other. This is what your husband said, or this is what your wife said.
Yeah.
But it's more like when your wife comes back in, I'm going to say, hey, here's the gist that I got from him as to the issue. Let me get your gist and then we're going to bring it all together.
Mhm.
You can't tell me something and then say, oh, but don't tell my wife that, don't tell my husband that. Because
Okay.
that's just not in the spirit of good therapy, period, to have secrets like that in couples therapy. I have had couples say, nah, I don't need alone time, and that's fine. And I've had couples say, yeah, I think that would be helpful to just have a little time alone. And we do that too. It doesn't really say anything in particular about the couple. I'm not interpreting that. It's just a comfort thing, I think, for people. And
For
then
the
we set
first one-
goals at the end. What are our
set
goals? And then
Goals
that
for the
kind of
couple as a whole.
lays our framework for moving forward.
Do you have an example? Like what tends to be the main, most typical goals, most common?
Improve
and then
communication.
Say, number one.
Improve communication without
wondered.
fail is a goal for, I think, every single couple I have ever met with. And frankly, that's no knock to couples who end up in therapy. We aren't trained on how to communicate well, period. That it's not something that we typically get. I did not learn certain communication things until I went to a doctorate program in psychology. So
Right.
I improve communication. Number one goal, and it's a goal for just about every couple I work with. I guess to address the sex therapy piece, not all couples who come to couples therapy need sex therapy. Some couples are doing just fine in their physical intimacy, and that is not a goal of theirs.
Right.
I do ask all my couples about their physical intimacy at intake, because we know if you don't ask clients about sex, they're not going to talk about it typically, because it still has a lot of taboo and it doesn't seem polite, which I could give a whatever about politeness.
I know.
Yeah.
So I have that happen so often. The two things that I see with clients, especially, and I probably could do a better job of like trying to normalize or ask more about it in the future, but the two big things that I've had clients kind of shy away from sharing about the most. One is, oh, can I talk about drugs? But that's back like we work with like the college population,
definitely.
especially like, and sex.
Yeah.
Like, oh, like we're talking about sex,
Yes, and I get a lot of
Yes, you can talk about sex in
euphemisms.
here. Oh,
Yes.
yeah. The
Like,
euphemisms are very
and
creative.
I feel like physically we maybe could use some help. I'm like, oh, okay, like with sex, intimacy, like how are we doing with those things?
Yeah,
So I get a lot of euphemisms for sex,
and the amount of times that I'm like,
pieces.
I'll be like, are we talking about oral sex right now? And they'll be like, yes. And I'm like, okay.
Yes. And I have to be kind of blunt. So like sometimes when I can tell someone's a little more uncomfortable, I will go ahead and embrace some euphemisms with them of, okay, like what about individually? Do you feel like you individually struggle with intimacy? And they're like, what do you mean? And I'm like, I mean masturbation. But I think you'd be uncomfortable if I said the word masturbation.
I was also, my brain was like, are we talking about finishing? Are we talking about orgasm now? What are we working on here?
But with my individual clients, when I ask about relationship history in the intake, I usually include a question about, are you having any concerns sexually with your partner or with partners in general if you don't have anyone serious?
Yeah.
Because if I don't ask, people generally won't talk about it. And also, I need to demonstrate the comfort so they can join me in that space to know, oh, I can talk to her about that one night stand, or I can talk to her about how I can't orgasm and I never have. But not all couples who come for therapy need sex therapy.
Right.
But I do ask, and I would say pretty frequently, they say that they could benefit from some help in that department.
Just a little bit. Yeah.
And
do
then,
you ever have people who don't disclose anything and then it comes up later? Like, so let's say, for example, someone who hasn't ever been able to reach orgasm from like traditional, like partnered sex, they may not disclose, oh, like this has been the same with everybody. So I'm not going to necessarily write down on the intake form, yes, I would like to work on this, but it comes up later maybe?
Yeah. Yes. Definitely. Now, I will say I do open up again to individual and to couples clients if there's anything that is hard for you to share to my face, you can message me about it privately. But again, with that couples piece, I usually say I'm happy to talk about something privately. It is always with the goal of bringing it back to the group, though. So with that, if it's a partner saying like, hey, I've actually never achieved orgasm with this partner, but then we figure out, okay, how do we share that in a way that now your partner can hear that?
Now we got to focus
how-
on talking about it.
Yes. So that absolutely has happened actually semi recently. A couple that I was working with, I worked with them for a couple months and one did not disclose that they had had an affair. And so the other partner found out about it and then they came to therapy and then I found out about it.
But it wasn't like they disclosed it to you.
The
That
couple
was my
disclosed it
eyes
to me once the person who had
once
been
they had
cheated on
figured.
found
Okay.
out.
Thank you.
And so that was really challenging just to be transparent. And I was transparent about this with the client too. I had feelings about that too. I'm like, hey, we've been doing this work for months and there's been this thing that's been lingering that probably is impacting you all. And I didn't know about it. So how can I help if I don't know about some of these things? And also, that's not to just knock on the person who had the affair. They wanted to build up more safety in the couples therapy space so that they could feel courageous enough to share it there in time. So I have understanding as much as I had feelings of like, "Ugh, I feel like we've been wasting some time. Like that was stuff we should be working on." So yeah, I mean,
Boo.
it happens. It was
Yeah.
challenging. It was challenging for the couple. It was challenging for me. But we navigated it pretty smoothly together and we are all still working together and we're able to jointly heal from what that did to the couples therapy space as well as what it did in their relationship.
Yeah.
So yeah, I think it can be hard for so many reasons to bring things up, but that's our job as therapists to create that safety so that anything and
Yeah.
everything is on the table. Now, again, honesty has to have kindness with it. So I think that's what's helpful about focusing on communication early on in couples therapy is that we can say the hard things without being harsh. Because I think that's something that's really challenging for a lot of folks is to say
Yeah.
hard things with enough kindness and empathy that it's not harder than it has to be to hear.
Yeah. Yeah. There's not a great way to say it, but there's some better than others. Right.
For sure. Yes.
Right.
Yeah.
If you don't mind me like asking about this before we kind of transition more into sex therapy, like primarily, is I remember when, gosh, what year was it? Someone was posing a question about whether like any like challenges with the political climate was coming up with, I think it was before the election last year, like a year ago, probably, how that might be coming up in the room with our clients. And I remember you commenting, I'm kind of across the board with all of them. Some of it's not coming up, but then I remember you distinctly saying, I have one couple I'm working with. One is in one camp, one is in the other, and it's one of the main things that we are trying to work on. Like, does that happen much, or do you find that like communication really does sort of trump that even where it's, well, maybe you guys talk about it better or figured out how to like what?
Yeah.
I'm just curious.
Yeah, I'm pretty certain I know what couple I was referencing when I made that comment because I remember that was a big divide with them for a while. Like the divorce word was thrown out, the D word. If you don't vote this way, I'm going to divorce you. Couple
Okay.
therapists, we do not like ultimatums.
Yes, we don't like ultimatums, and I know that like out divorce, it like regularly in arguments is frowned upon.
Yes.
Right.
Yeah. And that's something that I pretty explicitly, if both people are coming to couples therapy, like I really want to give this my best faith effort. I am committed to working on this marriage or this relationship, whatever the status of it is. That is something usually I explicitly ask for at a time is that we then are not throwing out divorce as an option. It always is one. We know that. It's legal.
Yeah.
Okay.
It's
As
always
long as we are in this couples therapy process right now, it's off the table because you both are 2 feet in right now. So, and when that person said that, I was like, hey, we know that's not a helpful way to communicate. And also, that person had already talked a lot about their political beliefs. And I know they care a lot about equity and all of that and choice. And I said, by doing that, you're taking away some of his choice. And isn't that the beautiful thing about voting is that everybody gets a choice?
Yeah.
I would just said like, hey, that shuts down a lot of good communication we can be having. It shuts down some choice. And you would not like if he did that to you. You do this or I do this. That's just that's not fair in a relationship. So I tried to shut that down as best I could and direct the communication otherwise. But since then, I probably have 2 or 3 couples that have very different political beliefs, and it is
Mhm.
coming up more and more.
Yeah.
Or even just like one partner is a little more apathetic about politics and one is
The other
very
one is
passionate about
not. Yeah.
politics, and they
Yeah.
want the other person to be more passionate,
Yeah.
or they want the other person to chill out a little bit.
Can we dial
And
it back?
it is
Yeah.
about like, again, if that's not a deal breaker for someone, there
And I
are
think that was going to be
plenty.
my question about that couple. Like, what if she's saying that because it is a deal breaker to her? Like,
And if that's the case, then we have to talk about like, so then what does that mean for the relationship? I would probably say for me personally, having a partner that is also a feminist is a deal breaker for me. I'm glad I knew that about me before I got married and
yeah,
about
yeah,
myself when I was dating. My partner is a feminist. He is
yeah,
very aggressively feminist, and thank goodness, because that probably is a deal breaker for me.
yeah, yeah. And
Um,
like, it just again because I know transparency. Like
mhm,
one of the things that my husband talks about is some of the things that like we're running into just in our relationship with this. I didn't know when I got married that I was going to feel this strongly about this when I
sure.
had kids. We
Yep.
grow and we develop in different
Yep.
ways. And what if it does start to diverge? What if
Mhm.
it starts to turn into a deal breaker
Yeah.
instead? Right.
Yeah, and we can't predict those things. I'm glad I didn't marry when I was younger because
I
I was not
know.
as feminist when I was younger, and then I grew into more feminism, and then it's like, "Oh, shoot, that would have become a deal breaker for me." And that is why some relationships run their course and end because
Hmm.
we haven't grown in the same ways. And
Hmm.
that's okay. We can't predict how our whole lifespans are gonna go when
Yeah.
we're in our 20s and 30s or even
Yeah.
40s and 50s. Changes happen, growth happens, they
Yeah.
don't always happen
Stuff
together.
you can't predict, like
Yeah.
accidents happen, diagnoses happen, addiction happens. Like I remember
Mhm.
when I was in my second year of practicum training, I had a client that came in talking about an husband and everything was fine until he had an accident and then got opiates
Mm.
for
Yeah.
for treatment and then totally switched. And like
Mhm.
you can't predict that going into a
Yeah.
relationship. You know, I
Yeah.
think I see in social media a lot of conversations about, oh, this was a red flag, or I should have seen these red flags much sooner. And I think
Yeah.
you can only see the flags that like you have awareness about at the
Yep.
time,
I
and
think that's a
sometimes
great
other
way of
people are
putting it.
holding up like mirrors to you, like, oh, I don't know if I love this. And maybe that's you could be receptive to that or not. But
Mhm.
also some flags are different flags to other people. Like,
Yeah.
feminist for you is a big green flag. You know what I mean?
Mhm.
Like not
Mhm.
feminist, big red flag. So like,
Yeah.
but not everybody's going to say that. Some people are going to be like, it's a red flag if they have kids or if they want kids, because I do not want them.
Mhm. Mhm.
Some flags are totally subjective versus this person spoke to me in this way.
Yes. And again, like I think the kids example is a great one that you offered up, and that happens very, very frequently with couples I work with is like we didn't have these issues until we had kids. And it
Hmm.
is like stuff that wasn't as important to you is now all of a sudden more important to you, or there's
Yeah.
so much more stress on the relationship now. So
Yeah.
everything
Yeah.
is harder, or you have less time together. And so what you would generally be able to work out with X amount of time, you now only have Y amount of time. We can't predict what's going to change. And I think that's the lovely thing about couples therapy is if we can infuse more of what I would call the foundational skills, it gives us as many resources as possible to
Hmm.
tackle the things that are becoming sticking points for folks. And if we can do that in a well communicated way where we're also still bonded with each other, sharing interests and fun,
Hmm.
and our goals are still aligned, our values are still aligned, and the big values that you all decide is important
Yeah.
to you, then it's like, yeah, then I think you can navigate the ways in which you all might not grow in the same ways. And then also, like, without those skills, or even with it, sometimes folks still find that the relationship is not sustainable. And again, that's okay. Not everything can
Yeah.
last forever. But a lot of times, like, if we can get all the skills there, then folks can really say, okay, well, if we have these supports, we got this. Great. And then the relationship
Hmm.
can heal and y'all can keep growing together and all of that. But kids is a major shift for couples, no matter how prepared for it you are or
Hmm.
not. So many things can shift with that. Just like loss is
Hmm.
another thing, like when a parent dies, or as we're having to navigate some of those big, big stressors in life, like kids, loss, financial changes. And then, yes, I do think some of the political stuff it can shake up a relationship really profoundly. And I think those are some key times when we see a lot of couples need more help and come to therapy,
Hmm.
which I'm glad they
Hmm.
do. And there's no shame.
Right.
Most of us need
Do you,
help at some point.
Literally. Do you ever feel, okay, the things that are coming to mind for me as part of some of our studies was like one of our professors say that success at couples therapy isn't necessarily staying together, number one. And then
Agreed.
there's also, I distinctly remember a professor when I was in undergrad talking about working with couples and having some couples essentially like one person is actually not in it. They're already done by the time they even got to couples therapy. Do you find
Yeah.
that comes up for you?
Frankly, I'd like to be better about assessing that. A lot of
That would be so
couples,
hard to read, the
yeah,
outset.
a lot of couples therapists ask that question at every intake with couples. On a scale of 0 to 10, what is your level of investment in the relationship right now? 0 being, I'm pretty much 2 feet out the door and like, I'm just doing this to check a box.
Say
10
that
being,
we did because they're
yeah,
like, oh, don't
10,
leave me. Let's go do couples, whatever.
yes.
Like, yeah.
And 10 is, I'm so in this, I'm willing to do anything and everything to make it work. A lot of couples therapists ask that question without fail at every intake. And sometimes they'll ask them to write it down and then share it with the therapist. Or do you want to share it together? Do you want some time to think and you tell me at the next appointment? So there's a couple different ways you can do that. I'm not great about doing that every time. I certainly do it if I'm getting some energy. Sorry if you can hear my dog barking in the background.
Oh, as my cat crawls all over me? No, no problem.
The
Was
beauty
that,
of working at home.
who was that?
That's Meech going. If I'm kind of getting a sense that the energies are different between the two partners, or one is seeming a little more tapped out, sometimes couples come in and they are fighting bitterly in the first appointment. Again, there's a lot of people where I can tell they're on their best manners at the first appointment.
Yeah. And
Are
it
you
comes
picking
out
up
the
too
next
much of
one's.
that?
It's fine. Don't worry about it. I'm sure I could take care of it.
I
Here,
can wait till they're done.
somebody must be walking by.
Yeah.
There's noise. I have them too. Surprised they
Amazon
have been
delivery guy
quiet.
had the audacity to deliver something to our house.
That's so incredibly rude.
I know. But yes, and if I'm getting those different vibes, different energy levels from the partners, that's definitely when I ask that question. The downside to asking them when they're both in the room is whoever goes first, the other person tends to base their answer off of what the first person said.
Yeah.
So it can be helpful if they're doing that intake style of splitting up. I then ask that question separately because when it's very normal for folks to have different answers on that. For one to say, I'm at a level 8, I'm willing to do just about anything to make this marriage work. And someone else is like, I'm at like a 4, like I want it to work, but
Tired.
this has to get better, or I
Yeah.
don't know what we're going to do. My hopelessness is a little higher.
Yeah.
And that's not a nail in the coffin for people to be in different places. It's actually very helpful as a couples therapist to have that answer because now I know, okay, infusing hope might be something that I should focus on really early on with them because that person's at a 4 because of hopelessness. So let me start with some strategies more focused on hope and optimism and excitement for the future to maybe that gets them a little more up to like a 5 or a 6. And then with that, there's a little more energy then to be really honing in on building those skills and tackling some of those resentments that have maybe built up. So that can be a helpful question to start with, but frequently I can kind of get a sense for folks where they might be on that spectrum based on what they're bringing to the first couple sessions.
Well, do you ever get a sense of like when they're done?
Yes, and frankly, I'm pretty honest with folks when I'm getting that sense of, I don't say, it really sounds like this isn't working anymore. That's not how I put it. It's more like, hey, I know we keep coming back to this argument, and I feel like we've tried to use the skills and really like apologize, forgive, try new things, but we keep coming back to it. What am I missing? What is left unsettled from this that we are having trouble moving on from it? Do you think you're going to be able to move on from it? Or was that truly something just way too damaging to move on from? Because if that's the case, like we need to hear that. So sometimes that's just an example of what that might sound like, but that sometimes is the invitation needed for a person to say like, I don't think I can move on from X, Y, or Z. Or
Or
other
something
times,
is still sticking there that you need to talk about.
yeah, sometimes it's like, oh, we really didn't talk about this piece. So like, let's dig into that. So hopefully we can put this to bed. Or other times me asking that is enough of a shocker or slap in the face or something to be like, hey, you've forgiven this person and now you continue to bring it up. If you're truly going to forgive this, then you need to allow them to make amends.
Yeah.
Not trying to put that onus on one person, but sometimes it is one person like holding us back a little. And by me saying like, are you going to let this go? Because we've now done X, Y, and Z, that then they're like, you know what? I do want to move forward with this person. So I do need to really let them do better and see the better that they're doing. Because lots of times the partner is making changes and improvements, and the other one is having a hard time seeing it or letting it sink in.
Yeah.
And sometimes that means that person just still needs a little more attention to their hurt. Sometimes it means, yeah, I'm just being stubborn on this and I really need to let them do better then. I'm not being fair to them at this point. Now I'm just punishing them for punishment's sake. And so
Right.
that question of like, hey, are we going to let this go? Or is this something we can move forward from? That sometimes can be the thing needed, regardless of which way it's going. And then there have been times where I have suggested maybe like a trial separation with folks of like, hey, we're not able to have many positive periods at all. And we need positive interactions to fuel us to deal with the negative ones.
Yeah. I think what the science that Gottman, for instance, came up with is that you need like 7 positive interactions to make up for 1 negative one.
Yeah.
Or something like that. Yeah.
Yeah. And sometimes we're too close, or it's too much in the same house, or it's too many stressors, and like a little breathing room can be really helpful for people. So there are times where I'm like, hey, what would that look like if we did have just a little bit more of a break from each other to breathe? And we have our serious, harder conversations here at couples therapy. You all have some scheduled dates with each other that are more focused on like fun and positivity, excitement. You guys can miss each other again. Like sometimes that can be really helpful for folks to just let a little steam out of the pot, give a little bit of a break, and then again, like kind of come at it with different energy. Sometimes that separation proves to be really enjoyable for both folks, so much so that they are like, this isn't working anymore. And then there are other times where they're like, that is exactly what we needed to let some steam out of the pot. That was so helpful. And it can like re-energize them to kind of come back together. That might be some of how that comes up for me if I'm really sensing like we are really getting stuck and need something a little more dramatic to shake things up.
What type of homework do you tend to give your clients in couples, both like sex therapy and non-sex therapy type stuff to do? Because I know I think you mentioned homework.
A lot of times if there's a conversation that or an argument, a discussion we haven't been able to finish in session, a lot of times it's like, hey, if you're still feeling energized for that, go sit out in your car and keep trying to do this. It's fresh in your mind. You're close to the office. You've got the skills top of mind. Like, why don't you keep trying to do that? Other times it's, I want y'all to drive home, just listen to some music, take some breaths, regulate, and before going to bed, try and have this conversation again. So that's homework a lot of times, is try to talk about this or practice this specific skill. So if things are really like hot with a couple, like hot meaning like very intense, lots of arguing, things like that, I might give them the homework assignment to talk about something relatively benign, but use the skills we're practicing. So that way we're just building skills without talking about the hot topics yet. So I might say, hey, I want you to talk about what you did at work, if that's a relatively benign topic for people. And I want you to practice reflective listening. So when she says, you know, my day was super annoying, like my boss just continues to micromanage me, then I want the partner to practice reflective listening. I know you've been so frustrated at work. Your boss is always micromanaging you. Yes. Did I get that correct? Yes, you did get that correct. So again, it's a very easy conversation, but we're using the skills. And it feels a little silly when we're using it on like not an argument.
Like sometimes
It's easier to
those
build
skills
skills when you're not exploding.
Yeah. And also those skills, we could benefit from that, potentially improves the communication, like so it could prevent some of that stuff building up into a conflict, right? Like some of that stuff. Sometimes reflective listening is just helpful anyway. Like you said, we haven't always been taught that.
Yeah. So practicing reflective listening is a very popular homework assignment. Trying to finish conversations that we didn't get time for. The other big one is practicing I feel statements. And that one actually is really hard for people. And I think it's because of how our communication, and people, I think will know this as soon as I say it. We start so many sentences with I feel, but it will say, I feel like you never listen to me. I feel like I just can't catch a break at work. I
feel like you're being a jerk.
Yes.
Like,
and none of those things are feeling words. So one of the most helpful formulas that we talk about in good communication is I feel emotion when situation. So I feel
Okay.
frustrated when my boss micromanages me.
Mhm.
I feel dismissed when I'm not heard properly.
Mhm.
And we try to avoid you language as much as possible
Mhm.
in couples
Mhm.
therapy. So I feel angry when you don't do the dishes. No, it would be I feel angry when chores aren't completed. I feel frustrated when we don't stick to a plan or when we don't stick to our
Mhm.
word. So we try to avoid you language as much as possible because it tends to make other folks defensive and it's very easy for it to come off like an attack. Practicing those I feel statements and that I feel has to be followed by an emotion word. So I feel sad,
Mhm.
I feel angry, I feel happy, I feel dismissed, I feel invalidated. That has to be an emotion word. And then we describe a situation or a behavior. We don't like attack a person's character. So that is a formula that is super helpful, but really tricky because we will say, I feel like all the time, but never
Mhm.
actually use the rest of that formula that's more helpful. So that's
Yeah.
very common homework. With sex therapy, I would say commonly, and actually this will maybe just segue us more into sex therapy, one of the biggest things that comes up with couples. So
Okay. Yeah.
folks are very bad typically at what's
Mhm.
called non-demand touching.
Ooh.
So,
Okay.
or what was called sensate focused work with
I
kind
think
of
I've
the
heard of
OGs that
that
came up
term.
with it,
Yep. Yep.
which
There.
is
Yeah.
Masters and Johnson, if folks are
Ah,
interested.
yes.
But
Masters and Johnson.
yes, but it is very easy, especially the longer a relationship goes on, that intimacy does become more demand like. When I say demand, I'm not necessarily meaning that one person is coercing the other person. That's
Yeah.
a separate thing. More just like, oh, well, he only kisses me when he wants to have
Wants to have
sex,
sex.
or
Okay.
she only gives me attention if I do this or that. It becomes more transactional, I guess. And that's what we mean
Mhm.
by demand. And or it's like we never have time for sex, so we finally have time. Like, come on, let's have sex. And it's like,
Yeah.
I'm not just like a microwave. I don't heat up in
Right.
2 seconds. So
Especially when the
one,
kids are involved, like
yes,
again, this is
yes,
our time.
yeah. And even my husband and I are in the throes of a new baby, only
Mhm.
10 weeks old. Right now, everything does feel like very tired. Like
Yeah.
we're both just like physically very tired. It's not feeling very sexy or romantic.
Not sexy
Like,
times.
there's lots of cute moments. There's
Mhm.
lots of, like, emotional intimacy of, "Oh, this
Yeah.
is so cool for us to be in this new role together," and, like, I love
Mhm.
seeing him as a dad, and, like, I do think that's very hot in a lot of ways. It is not translating physically, though, right now.
No, you're like sexy for later.
Yes. So, it's very, like, how do we still, like and if we were able to find the time, again, like, it's so out of mind, out of sight for me right now.
Yeah.
And
Yeah.
we will do that work when that is where the mindset we're in, but it's very easy then, like, once couples have time for something or we did a date night or whatever, that it feels very like, "Oh, well, we went out on a date, so of course we're gonna have sex when we go back." And, like, that it
Right.
feels more obligatory or demand
Mhm.
or, like,
Routine,
transactional routine, yes.
transactional. Yeah.
And those things
This is
tend to
what we
not
do.
be very, like, hot and sexy.
Mm-mm.
What I do with a lot of couples who are beginning sex therapy, where there is that dynamic where one person is maybe more of an approach person, another person is more of an avoid, or their
Mm.
desire is a little lower and the other person's is a little higher,
Yeah.
is we actually like take sex off the table.
Okay.
And we can't do it at all. Anything else is on the table. And
Mm.
so that is a way of like cueing folks into all the other things that are physically intimate besides sex. And by that, I usually define that as like penetrative sex. And
Mhm.
oftentimes I define that as oral sex as well.
Okay. Okay. We'll include
Everything
oral
else,
sex
we can
sometimes.
kiss, we can massage, we can touch, we can masturbate, we can mutually masturbate. We can do all the foreplay, we can do all the cuddles, all the things, but not that. And that way, like, a lot of times the lower desire person, like, doesn't even want to have kisses anymore because they know the other person then is going to want sex and they don't want sex tonight. They just want kisses. So that
Mhm.
is
It's
like they
nice to
can
know that you could
go
just have some kisses.
they can become more open to kisses because
Mhm.
they know it's just a kiss night. I don't have to also create the bandwidth for sex.
Mhm.
And it helps each person then get more creative. Make sure we're doing all the things that go into intimacy, not just sex. We're not just immediately getting on the highway. Got to take some side streets first.
Yeah. Take the
And like
long way.
it can, yeah. And like one of the best things for desire and for sexual satisfaction is positive anticipation.
Mm.
So usually with couples, we have this negative anticipation, like, okay, like, yeah, I'm really tired, but we haven't in a while. She's going to want to after we go on a date night. So, okay. And like, that doesn't feel super exciting. But if we take sex off the table and then we do all these other things, and a lot of times it's, oh, those kisses felt really good. Like, I kind of wish we could have had sex last night. And then there's a little bit more of that
excitement,
like
kind
positive
of
anticipation.
like goes back to some of that
increase.
ski type stuff from like the beginning of a relationship.
Yeah. Yeah. And then again, like it's kind of funny homework because sometimes people fail at it and they end up having sex. And I
Yeah,
put
you're not
feel
gonna
in
get in
quotations, you
trouble.
can't
Like,
really
yeah,
fail at it because
fail
it's
at
like,
it.
oh, you did it because neither of you could even resist it. It was so exciting to finally
Yeah.
have sex then. So I'm like, okay, tisk tisk, you failed. Or it's like, okay, you did it. What did you discover about yourselves? And, you know, sometimes one person's like, oh, I found that like I don't initiate any kind of touch. I really need to be better about that because I know that's important to my partner. Or I realize like I don't really know what's physically intimate outside of sex. Like I really need to bone up on my skills there. And so that is probably like the most popular homework I give as far as sex therapy is to do
Okay.
a lot of non-demand touching and like increasing intimacy without having sex to kind of build up that vocabulary, so to speak.
Do you do a lot of education around sex?
A lot of education, even just like, again, bringing these conversations to the table that we're too afraid to talk about. Are you both enjoying your sex? Does that mean orgasm for both of you? One of you? Is that something you both are able to achieve? Is it important that you achieve that? Not everybody cares about that. Is frequency something that needs to be part of the conversation? What are the barriers to having good sex? How has sex changed for you all as a couple? Because, like, there's aging effects that occur. Our bodies change. Pregnancy changes things for so many couples. Kids are changing things as far as just like, I mean, right now our daughter is so young, so she's in the room with us. Yeah, not hot. Not hot to hear a baby in the room.
Feeling of like, don't wake the baby.
Yeah, and that's never something we've had to encounter before.
Yeah.
It is completely normal for couples to not feel super hot towards each other at some point in their marriage, usually multiple points in their relationship. It
Yeah.
is super normal for one person to be high desire and one person to be low desire. There are gender differences biologically as well as just how we're socialized around those things.
And
So
if
a
like
lot of education
you run
around
into
that.
like people like what the gender differences and what if they fall in line with those and what if they don't and like the opposite like the partner feels a certain way about that maybe.
Yeah, yeah. And even just so women stereotypically are far more likely to have what's called responsive desire, and men are much more likely to have what's called spontaneous desire. Now, there are men who have responsive desire and there are women who have spontaneous desire. But spontaneous desire is like the wind could blow a certain way and a person's like, I could go for that. Like somebody brings it up or you see a scene or even just like a thought pops in your head randomly throughout the day where you're like, I could go for some sex. And then responsive desire is more like we could say the spontaneous desire is the microwave, the responsive desire is the crock pot. It's a slow cook. You need time, you need someone to set the scene, you need, responsive desire is, I'll use myself as an example. Like if the house is messy, I'm not going to be super focused on intimacy. I hate mess and I'm going to be thinking of this to-do list in my head instead of being present with my partner. So that's not hot for me to engage in that when in a super messy house or a baby being in the room, our dogs being in the room.
Yeah.
Those things are all like big turnoffs to me. And so like part of my responsive desire is setting the scene. Let's get the dogs occupied with a toy in their beds in the other room. Let's make sure baby is dead asleep. Let's light a candle. Let's maybe have some time where we can just lay in bed and talk for a little bit. Like all those things kind of help my body and brain get a little more in the moment of, oh yeah, this would be lovely. Let's do this. Whereas if I'm using this example, my husband could be like, hey, would you want some sexy time? He'd be like, yeah, I could go for that. It's about that quick. And some of that is our biological response cycles are different. Most gender differences are because of socialization. This is
I was just about to say, I
is-
was glad that you mentioned the two distinctions there because I was thinking like high libido, low libido, like in terms of like gendered stuff. And so when you said the responsive versus like spontaneous, I was like, oh, okay. Yeah.
yeah.
Okay.
So some
I'm
of
learning.
is biological and hormonal.
Mm-hmm.
And then female sexual response cycle on average is like 45 minutes to an hour. And what that represents is like the first thought of sex to quote unquote completion or feeling done. That can be
Okay.
orgasm. It's not orgasm for everybody.
Yeah.
And the male sexual response cycle is about 7 to 10 minutes. So there's a huge
Holy
gap there.
shit.
Yes. So
Oh
from
my
their
God.
first thought to completion can be as quick as 7 minutes. These are also averages. So
Right.
let's
Yeah.
not,
To be
I
fair,
have
yeah.
no interest in people comparing how long they can last. But what we have to do then is we are doing our best to shorten a woman's cycle and lengthen a man's cycle if we have, you know, a
Kind of that.
male-female dynamic.
Yep.
And so even just like education around that can ease the conversations a lot for couples because these can become so contentious of, well, he doesn't even want me, she doesn't even want me, you
Yeah.
know, and it's like she doesn't even care, or this is all he cares about, or whatever the examples are. And so even just education around that of, hey, this is typically how our bodies operate. We're already in this big gap. We need to find ways to close that gap. And that's all about discovering your own sexual style as a couple. Just like that education alone goes a long way for couples, I think. Of, okay, what are all the ways to turn off the offs for the person with the responsive desire so we can shorten their window a little bit and make it easier for them to access that part of themselves.
Yeah.
That person with the more responsive style, hey, how can you really try and take more initiative here of speaking your partner's language then too? Like, what are all the things that get you going? How can you kind of work on that in your own, in your head as the day goes on? So, like, if
Yeah.
you need more warm up time, what are you doing to also help warm yourself up so that you're warming yourself up? That partner is warming you up. Okay, we have now shortened your cycle a little bit. We've maybe lengthened his a little bit. And yeah. And again, I use those
Yeah.
examples because like stereotypically that's what you find more, but
Right.
it can look different for each couple.
Okay. If you don't mind, I'm gonna have you back for like another just bigger picture sex therapy, maybe some
Sure.
couples, but like mostly like individually type
Mhm.
stuff. Cause I feel like there's so many more questions and things that we could get into. Like you're
Totally.
just okay, this is where the first you're just a field of knowledge, all in one person. I was starting to say you're a hotbed of knowledge.
Hey, in sex therapy,
You
we
know,
always have
sex therapy.
double entendre, so I'll take
Double
it.
entendre, yes.
Yeah.
You're a hotbed of knowledge and you explain things so well.
Thanks.
I just want to be mindful of your time and like what we can do with it. So I was just going to ask if we can answer this question short,
Sure.
like no, then that's great. If it needs a longer answer, then we'll save it for next time. I think that from your perspective as a couples and a sex therapist, that all couples have to have sex to be in a healthy relationship.
No.
Okay.
No, I think again, I guess my asterisk there is if one partner is saying that really is a big deal breaker for them, well, then, like, again, it's not for me to decide what can and can't work for a couple. The couple has to decide what can and can't work for them. So, absolutely. And actually, currently, I'm working with a couple where one has said, like, I don't know if like penetrative sex is going to be back on the table for me at any point. Like,
Wow.
it has been so long since I've enjoyed it. They're experiencing a lot of sexual pain, which is a big part of sex therapy is sexual
In
pain.
and of itself, right?
Yeah,
Yeah.
especially for female partners, unfortunately.
Mhm.
What if penetrative sex was never back on the table here? Like, is that something that feels reasonable for you all? Is that
Mhm.
something that you all could navigate?
Yep.
And that person's partner said yes. Like without pause, yes, that's something we could navigate. Now,
Okay.
they do want to focus on like still having physical intimacy with each other.
Mhm.
And that partner who answered yes so quickly also was like, I don't want to just be roommates. So that roommate phase is a big thing that comes up in couples therapy of
Yeah.
like we're really good at being roommates and like maybe even co-parents, but we're not very good at being a romantic couple anymore.
Mhm.
Most couples go through a couple roommate phases across their relationship span. So that is a very, very common. If anybody is in that, y'all are not doomed. A lot
Right.
of people, I would say right now, my husband and I are really good at being roommates because we're in
Mhm.
baby land. So
Yep, same.
having like a conscious agreement around things in a couple is far more important than like hard and fast rules.
Mhm.
So if both are aware that something is off the table for now or for always, and both are consenting and agreeable to that, then who am I to say that you must have sex for a
Mhm.
relationship to be healthy?
Mhm.
There's also a
Mhm.
lot of asexual people in the world where like that's just not something for them, period.
Mhm.
Or it's something for me in very small doses, but it always feels a little bit more like homework. But I'm willing to
Mhm.
do homework sometimes because it's good for my
Yeah.
relationship.
Yeah, because I
So,
also love this person and yeah.
yeah. So I don't think you have to have sex for a relationship to be healthy. I do think we have to have agreements and consent
Mhm.
and conscious awareness around these things, because if it's happening subconsciously or we're just not talking about it, I do think that's a lot of fodder for resentment to build up. And resentment is really, really tricky to work on in a relationship. But yeah, I think just about anything is on the table as long as people are consenting to it. I mean, this is a whole other can of worms that we don't have to open, but even like, for some folks, monogamy has
Mhm.
to be the
You read
thing.
my mind. I was like, God, that's
Yeah.
a whole other thing.
Yeah. Because even
Yeah.
most of this conversation, I've been saying couple or
Yep.
partners implying two.
Yep.
But there was debate, and there probably still is. I just don't really bother myself with it all that much anymore about, oh, well, can a healthy relationship have more than one partner, or do you
Partner.
have to be a
Right.
monogamous duo?
Mhm.
I think there are so many ways to have a healthy relationship. It could
Mhm.
be more than two partners, it could be sex, it could be no sex, it could be kink, it could be
Right.
no kink, it could be kids, no kids. Like, whatever
Mhm.
the prescriptions are out there for how to have like a healthy, happy marriage or relationship, I think anything is on the table as long as everybody is aware and consenting to it. So, yes, I think there are ways absolutely to have a healthy marriage where maybe there's multiple partners, or
Mhm.
an open marriage, or like,
Yeah.
again, as long as
Yeah.
things are being discussed and consented to and
The
agreed
consent.
upon,
Yeah.
then I don't make the rules on what is healthy.
Yeah.
We tend
Anything
to
that falls
see,
under like
yes,
if people are on board, then
yes.
they can make their
And
own rules.
I would say what goes across, what we tend to see in the couples literature, at least, is good communication, trust and fidelity, shared values and interests tend to be
Mhm.
things that predict satisfaction in a long-term relationship.
Mhm.
Now,
Mhm.
trust and fidelity does not have to be monogamy. It's like
Mhm.
fidelity to the relationship agreement. If the
Mhm.
relationship agreement is monogamy, then great. If the relationship agreement is we swing every other weekend with other couples, cool. But yes, good communication, trust and fidelity, and then shared interests, goals, and values. When folks have that, long term relationships tend to be happier and healthier.
Yeah.
Um,
We were talking off mic before we got started. There was a discussion about sexual attraction versus like emotional attraction. Can we touch on that real
mhm,
quick and then we'll transition to our wrap up question so you can get back to baby?
yeah. So we were discussing a client before we started recording, and yeah, it brings up kind of a age-old question, I suppose.
Mhm.
Something that Esther Perel talks a lot about is, can we have that sexual fire and passion and excitement and eroticism with
Mhm.
emotional safety and comfort and that type of
Mhm.
intimacy? And my understanding from her book is a lot of times she's like, I don't know that you can really have both in equal measure.
That doesn't mean you have to have 100% of one or the other, right?
Right,
Like,
right.
yeah.
So I would say a lot of relationships, certainly folks I work with, where that comes up, like, this person is my best friend. I want to spend so much time with them. Nothing is more fun than hanging out with her. But like, I don't know, like, I feel like we're really having to work at the sex part. And that was just an example, but
Yeah.
that can almost feel like a trade off, because if
Mhm.
sexual eroticism is defined as like riskiness and play and
Mhm.
newness
Mhm.
and all of that, and if we have so much like comfort and safety and familiarity with someone, it makes sense that that kind of comes at the expense of the other. Now, again, like, knowing that that's a common struggle in and of itself is something that helps a lot of couples, I think. And then again, it's, hey, like, it's okay if that's not your strong suit. You guys are really good at this emotional intimacy piece. Let's use that, because you got so much safety and comfort to talk with each other. So let's try and talk about some of that, like sexual riskiness or eroticism stuff. Let's use your strength to work on the weakness, if we want
Mhm.
to use, again, the
Mhm.
binary language.
Right.
So, and again, like, it's not for me to say if any of that is a deal breaker or not.
Right. Yeah.
What I had
I
said to
think you
me
right, I was gonna
personally,
say we agreed. I think we have this in common that
yeah,
like we go ahead.
I probably like it. And again, this is just me. This isn't the rule
Mhm.
for all people.
Yep.
it's probably better and healthier for me as a person to have more of that emotional intimacy and safety and comfort and familiarity. And I would rather work at that sexual piece if I have to. For, again, me personally, working on that like intimacy and safety piece feels harder. And so I'd rather work at the sexual stuff than the safety stuff. Now, there are other people that would say they are the complete opposite, and that doesn't mean they're right, I'm wrong, or any of that. It's just personal difference.
And one of the things I've said to a client myself is you get to a point, especially when you're growing as a family, I will take someone who shows up as a father, a parent, and a partner in that way over somebody who just wants sex, and is not supportive in other ways that I need, that you can rely on, someone who's reliable in that way.
Yeah. And like passion and excitement and like riskiness and fun, like those things are so important too. And so that's not my way of saying, oh no, safety is more important than hot, fiery sex or anything like that. It's all important. It's all lovely. And again, it's just like, where do you feel comfortable channeling more of your energy? And so for some folks, like, hey, we can totally learn ways of shaking it up in the bedroom or trying new stuff or infusing more of that passion and excitement. Let's focus that there because you all are really good in this area. So let's leave that alone because that's going well, or we're going to use that to work on this other area. And so I know it can be frustrating to not have the best of all worlds, but and that's probably where feminist psychology, but also like positive psychology comes in a lot for me is let's use the strengths, let's use the stuff that's already working to focus on the things then that aren't working as much. Because again, and that's something that I come back to a lot with couples. You all fell in love. You all have so much good stuff here. Otherwise, you never would have bothered to come to therapy. Why do all this hard stuff if it's not worth working on? Or you never would have gotten married, or you never would have had kids together, whatever their markers are.
Yeah.
You've got so much good stuff. Like, what did you originally fall in love with? What does your partner still do so well for you? And I like to hear about those things a lot because that's the stuff that energizes us to do the harder things.
And it also gives you the warm fuzzies. It's like, that's the gooey stuff.
Yeah. Yeah.
Like,
that's always lovely to hear.
And if that's not there, then it's like, then you don't even know what you're working toward. I mean, as the therapist, let alone the couple.
Yeah. And I will say, like, a common myth, then I guess and then we can shift into the final questions you have. Common myth is that, and this goes for individual therapy too, that it is all like hard, that it's scary, that it's depressing. People say that to me all the time when I tell them I'm a therapist. They're like, I don't know how you listen to people's problems all day long. That's got to be the most depressing job. And I always dispel that myth whenever anybody says that to me. I'm like, yes, of course there are hard sessions or depressing days. I was like, but therapy can be so fun. And even with some of my couples, when they achieve a new skill or unlock something, I also just like couples are really funny together. Like they have their own inside jokes and their unique little things. And like, there's so much love in the room, even in couples therapy when we're angry and fighting at times. Like, I laugh a ton with clients, even the ones that are going through super depressing shit. We usually can find a place for like humor and fun and like so with couples too, like it is not all just like angry arguments in couples therapy or contention. Like there are so many times where we are like laughing together or excitedly planning something or sharing a win. Or actually, right before I went on maternity leave, I had 3 different clients announce pregnancies to me, and 2 of them were having fertility struggles. And I'm like, yeah, working with them through infertility was, of course, sad and challenging. And then you have a session like that where like I was crying, they were crying, like it was so happy. And I'm like, as many depressing sessions as you might have or arguments you might have in couples therapy, there's just as many like wins and excitements and, points of optimism and all that. So that's probably one big myth about couples therapy is that you're just going there and fighting week after week.
Well, I know what I'm going to say, what my husband always says, especially when we're at a restaurant with a kid, we're on borrowed time here, or we got a ticking time bomb or whatever. So let's do the quick wrap up stuff. But have loved this conversation and hope
me too.
to have another one in the future. So the questions I like to ask, for instance, are where are you licensed?
So I'm licensed in the state of Ohio. So I practice in person in the South Dayton area.
Mhm.
I can work telehealth with anybody in the state of Ohio.
Good. Do you have openings right now?
I think I do actually. So because I just took 12 weeks off for maternity leave, a
Yay.
couple clients did just decide that they were doing well and have dropped off. So I'm coming back November 3rd, and I do believe I'll be able to open up to probably at least a small handful of individuals or couples.
So if you want to
Yes.
get in there, get in there. Do you take insurance?
I do take insurance.
Mhm.
So I work with Anthem Blue Cross Blue Shield, which is under the Optum umbrella. They have
Mhm.
a bunch of companies that work under
Yeah.
them. So I always encourage folks to check because there's Surest, there's UMR, there's UBH,
Mhm.
Optum, and all of those are under like the United Healthcare umbrella. Always
Right.
check your insurance. If you're looking, you can ask them my name and they usually can tell you if I'm paneled with them or
Mhm.
not. So Anthem, United Health, Medical Mutual, Custom Design Benefits is an open network, so I can work with them as well. And then I also do private pay rates. I do try to have a little bit of a sliding scale fee. So I
Mhm.
have an idea of what I would like to make per session. I ask
Mhm.
folks if they can do that. Can we please meet that? If not, I will
Mhm.
maybe flex it down, 20, $30, something like that.
Yeah.
If people can't do it.
Yeah.
But yes, I do work with insurance, and I would say majority of my clients are probably using insurance.
Yeah. And it's kind of rare to find a couples therapist that takes insurance, correct?
Insurance makes it a little harder to bill for couples. So
Yeah.
a lot of us don't want to do it, but I do try to stay available for that.
Yeah.
'Cause
You're
the
excellent with that.
economics be hard these days.
Yes. And what is your current fee that you like to stay at, even if you are on a sliding scale?
150 for intake and then 125 for subsequent sessions. I may have to reevaluate that in 2026
Yeah.
just
So
because,
that's
like
right.
I said,
Asterisk current fee.
yeah. Then for couples, typically 175 for intake and 150 for subsequent sessions.
Yeah.
And then, yeah, usually each year I kind of evaluate, is that still an okay place for me to be? I skipped that evaluation in 2025 because I was taking
Yeah.
time off with families.
And what do you like to nerd about?
Oh, wasn't expecting that one. I
Quirkier
mean, like,
ones.
I am a psychology nerd. Like, it
Mhm.
is good that my husband is a psychologist. So we both listen to a lot of mental health and psychology related podcasts. And so then he'll come home like, oh, I was listening to this episode. And like, so we do
Yeah.
nerd out about a good of like psychology stuff.
Yes.
Are haters on the self-help industry. So we do like have some fun with just hating on those things.
Oh, I want to
and
hear
I
more
am
about this off mic.
I do love like media. So like movies, shows.
Mhm.
I could talk movies and shows all day,
Yeah.
every day. I have always loved going to the movies and losing myself in a story
Yes.
and like debating about fictional characters,
Same.
impact our lives in no way. I could do that for hours.
Yeah. Yeah.
I definitely am loving some of the trash reality TV right now, like the Netflix reality shows, those dating shows.
Nice.
Like my husband and I will watch them and then just be like, I can't believe she's talking to him like that. Like it's so immature.
Like it's not the point of the show. That's what gets with me.
Yes.
Like that's one of the reasons I can't watch those shows. I take them too seriously. I
Way
get
too
so
serious.
invested.
We'll debate and
Yeah.
like I'll
Yeah.
start sweating watching something because I'm like getting so heated.
it's
But
me.
I do love those things. And then I do also I'm a millennial woman that I do love me some true crime.
True
So
crime. Oh my gosh, yeah. Do you
yes.
still do My Favorite Murder?
I do. And I love
Podcast?
My
Yeah.
Favorite Murder so much.
I need to get
old
back on it.
episodes, which I
Oh.
love because I'm listening to them like it's like they're brand new.
I haven't listened to it in years, but I need to go back to it. I know that we also love the Maintenance Phase podcast as well.
yes,
So
yes.
I think I'm
And
a little
do you
behind, which
listen
I'm
to the
not
other
ever mad
one?
about it.
If Books Could
Sometimes
Kill?
I'm behind on it, but yeah. They're so
Because I
cute.
love
I
Mike.
remember you're like,
He's such a good
"Cute."
host. Yes. And those are podcasts that both my husband and I listen to. So he'll be like, did you listen to the new maintenance phase?
Yeah.
No, I'll listen to it tomorrow on my drive to work. And then that way we can come home and talk about it at
Chat
dinner.
about it. Yeah. I love it. You just like want to talk with them in real life. Like you feel like you're a part of the conversation.
I really feel
And
like we
so-
would have fun if we all sat down together.
literally, like if
Yeah.
only we could make that happen.
I know. Yes.
Only we
But
were,
yeah, those are
thrown to
my
a
nerdy
parasocial
interests.
collection.
Yeah.
Do you have any pets?
I do. I have two dogs. They are very poorly trained, and I have to shout at them all the time. I don't understand why two therapists who are trained in behavior modification can't handle it. So
I have the same with my old pups, as you know. Yes.
yes, we got two dogs,
so
a little
loud.
shepherd. Her name is Gemma, and then a pit bull named Meech. They hated each other when they first met, and they now can peacefully coexist. They're good
They're
with
good
the
with
baby.
baby. They're good with the baby. That's what
Good
we
with the
need.
baby. We'll see how that continues to transition into toddlerhood, but
Yeah.
we'll cross
Yeah.
that bridge.
I
Okay?
know, one step at a time. Coffee
Yes.
or tea?
Coffee for sure.
I thought so. And I think we can wrap it up there, but like, how about we touch really quickly on where clients can find you?
So I'm on Psychology Today. So if they type in my name, I'm probably going to show up. So that's on psychologytoday.com. And then my practice is called Life Psychology LLC. And I believe that's my website is lifepsychologyllc.com.
Mhm.
So that is also where I have more written about my theoretical orientation, my approach. I always update that as to if I'm taking new clients.
Yep.
And that's where folks can fill out information about themselves if they're interested in becoming a client, either going to Psychology Today or to my website. Both come to the same place where folks then can express interest and we can see if we're a good fit.
And just for fun, life, I remember it stands for something, right?
Yes, love, insight, freedom, and empowerment, because those are some of the major
Tenets.
components that I focus on with clients, is like building insight, finding self-love or rekindling love in a relationship, and then also finding freedom from the systems and structures that kind of hold us back and empowering folks to embrace the changes that can maybe move them forward. It's where that all picking a business name is really hard. That took me a long time.
We made it. I don't know how she's let us do this, but we're going to let you tell you go hug your baby.
Thank you.